Hi, I'm Shelby. I'm going to be your nurse today.
Hello.
Could you give me your initials and date of birth, please?
MF, April 7th, 2000.
All right, and your gender you identify as?
Female.
And your occupation?
I'm a student.
Great. And do you know where you are today?
Colby Sawyer.
And the date today?
December 3rd, 2019.
Good. And how old does that make you? You said you're
19.
19. Okay, so patient appears their stated age. They seem alert and oriented. They know where they are. The skin color is pink and white. The nutritional status seems adequate for this age. Posture and position is relaxed. Mood and affect seems positive. Facial expression is neutral. No visible deformities. Mobility will be assessed later, but as I can tell now, it seems intact. Speech is fluent and English is the native language. Hearing seems adequate, and then personal hygiene is good and well kept. So what brought you in today?
I just need a physical exam.
Great. And if I were to ask you to rate your pain on a scale of 0 to 10, 0 being no pain at all to 10 being the worst pain you've ever experienced, what would you rate it?
0.
0. Great. So I'm going to start by assessing your hands if I could see them. So they are warm, pink, and smooth, and good turgor on this one, and good turgor. And cap refill is less than 2 seconds. And I'm just going to check this side. So there are no visible lesions or abnormalities, so those look great. I'm just going to assess your scalp. Any past head trauma or issues with your head that you know of?
Nope.
Good, so there are no visible lesions or abnormalities on your scalp. Next, I'm going to have you make these faces back at me. So I'm going to smile, show your teeth, and frown. Puff out your cheeks, and raise your eyebrows. Great. So cranial nerve 7 is intact. Next, I'm going to have you clench your jaw and open against resistance. And I'm going to have you tell me when this touches your face. This is what it feels like, so if you could close your eyes.
Yep. 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 Yep.
Great. So cranial nerve 5 is intact. Next, I'm going to check your eyeballs. If you could cover this eye with me and tell me, look straight ahead and then tell me when you see my finger.
I see it. I see it. I see it. I see it.
Great. Now we'll do the other eye.
I see it. I see it. I see it. I see it.
Good. Now we are going to check your line of sight, or your 6 cardinal fields of gaze. If you could follow my finger, no moving your head, just with your eyeballs.
Okay.
Any blurriness or double vision?
Nope.
Great. And then if you can follow my... Great. So cranial nerve 4 and 6 are intact. Next, I'm going to check the dilation of your pupils, so I'm going to just dim the lights prior. Alright, so I'm going to check both eyeballs. Good, so there's good dilation and constriction present in both eyes. So that signifies that cranial nerve 3 is intact. I'm just going to turn the lights back on. Alright, so I'm going to check your ears now. Is there any tenderness present in them? Any problems with hearing?
No.
Good, so they are warm, pink, and smooth. And I'm going to have you cover one ear for me and tell me when you hear this.
Mm-hmm.
Okay, and the other ear?
Mm-hmm.
Great, so cranial nerve 8 is intact. Next, I'm going to have you occlude one nostril and close your eyes, and if you could tell me what you smell.
Alcohol.
Alright, and we're going to do it with the other.
Alcohol.
Great, so cranial nerve 1 is intact. Alright, now I'm going to check your mouth and throat. Alright, if you could just open your mouth, I'm going to check your lips and buccal mucosa. Alright, so they both appear pink and wet and moist and no visible lesions or deformities. Now I'm going to, if you could open your mouth so I can see your teeth. Great, those look good. And can I see your gums? Good, pink, and no problems with your teeth at all. Next I'm going to check your hard and soft palate. If you could open up and lift your tongue. Good, both shiny and veiny. Next I'm just going to check if you could open your mouth again. If you could say ah for me. Good, so your uvula is midline and your soft palate moved. So cranial nerve 9 and 10 are intact. Next I'm going to have you stick out your tongue and say, stick it to the right and the left, and say light, tight, dynamite.
Light, tight, dynamite.
Great, so that indicates that cranial nerve 12 is intact. Next I'm going to check cranial nerve, or your neck, excuse me. So it appears to be symmetric with no visible deformities, and I'm just going to give it a quick feel for any lumps or bumps. Good. So there are no visible deformities. Your skin is pink, warm, and smooth. And now I'm just going to feel for your carotid pulse on both sides. Good, so it's bilateral and strong on both sides, and I'm just going to give it a quick listen now. Great, so that sounded normal, no bruise or present, so no turbulent blood flow. Next, I'm just going to check if your trachea is midline, which it is, and if you could swallow for me. Good, and so your swallow reflex is intact. Next, I'm going to have you shrug against my resistance, and then push your head to this side and to this. Great, so cranial nerve 11 is intact. Next, I'm going to have you take your shirt off for me, and I'm going to check the back of your thoracic cage. Alrighty. So it appears symmetric and within normal limits. The skin is warm, pink, and smooth with no visible lesions or abnormalities. And now I'm just going to check for some symmetric expansion. If you could take a deep breath in for me. Great. And now I'm going to check for tactile fremitus. I'm just going to raise the bed up. Great. So every time I put my hand on your back, if you could say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Great, so I had good tactile fremitus, everything's normal. Next I'm just going to percuss your lungs. Good, so that had good resonance, everything seems normal for that. Now I'm just going to give your lungs a listen, and I'm going to have you take deep breaths in through your mouth, and if you need to take a break at any time, just let me know. Great, so those all sounded clear and good and healthy lung tissue. Next, I am going to have you spin around, and I'm going to listen to your front. Your breath sounds seem within normal limits. Great, clear breath sounds on that side as well. I'm now going to check your range of motion and of your upper extremities. So if you could pronate and supinate your hands for me, and then spread your fingers, and then flex and extend your elbows. And then I'm going to have you bring your arms up and back, and then around and across your body, and then behind you and pull, and then up. Great, that all looks within normal limits. Now I'm going to have you lay down, and we're going to do an assessment of your heart. So I'm going to check your jugular vein distension. If you could turn your head to the left. I'm just going to grab my pen light to check. Good, so that looks within normal limits. No dissension is present. Next, I'm just going to visualize your precordium to see if there are any thrills, which I do not see, and everything seems normal. Your skin is smooth and pink and dry and warm, and I'm just going to palpate now for any thrills. Good, that all seems normal. Now I'm just going to listen to all the different heart sounds. So feel free to relax. So first I'm listening to the apical pulse, the aortic valve, and then the pulmonic, and the tricuspid, and the mitral. All of those sound normal and within normal limits. And now I'm just going to listen to your apical pulse for a full 60 seconds. And we'll get the rate and rhythm for that and make sure there are no issues. Great, so that all sounded normal and regular, and your pulse rate was 68. All right, now I'm just going to give a quick look at your abdomen. Is there any tenderness here?
Nope.
All right, and I am just going to visualize it first. It all looks symmetric. Your umbilicus is midline, and I'm going to listen for any bowel sounds and vascular sounds also. Good, so bowel sounds were present in all 4 quadrants, and now I'm just going to do some percussion. Good, and that signified good resonance. So there were no vascular sounds also. Next I'm going to palpate. I'm going to palpate the superficial layer first, and then I will go a little bit deeper. Let me know if at any time it's uncomfortable or any pain. So the skin is warm, dry, and smooth. There are no lesions, no abnormalities at all, no pulsations. And I'm just going to go a little bit deeper. So everything seems normal, no organomegaly. Now I am just going to check your lower extremities, which seem symmetric. The skin is warm, pink, and smooth. And I'm going to check your dorsalis pedis pulse. Which are both present, regular and bilateral. Now your posterior tibialis pulse. Which are also both present and bilateral and regular. Next I'm going to check here for any pretibial edema, which I don't see, and normal warmth of your skin. Now we're going to do some range of motion. So I am going to have you bring your knee to your chest, and then bring it out and back in. Good. And then if you want to straighten your leg and bring it up and then out and back in. Good. And we're going to do that with the other leg. So bring this knee to your chest and bring it out and in. And then straighten your leg and bring it up and out and in. Good. So that is all normal. And if you want to stand up for me, we'll do your knees. So if you want to flex and then extend your both legs. Good, both are normal. And then I can have you take a seat again, actually. So if you could wiggle your toes for me, and then press down on the gas with both feet and pull up. Good, so good ankle and toe range of motion. Next, I am going to have you do a sharp versus dull test. So this is the sharp, and then this is the dull. So if you can close your eyes, I'm going to do this around your body, and you can tell me which sensation you're feeling.
Dull, dull, sharp, sharp, dull, dull, sharp, sharp, sharp.
Good, so cranial nerve 5 is intact. Next, I'm just going to check your cerebellar function by having you touch your nose and then touching my finger. Great, so that is all within normal limits. And I am going to have you bring your heel of one leg down the shin of your other, and then repeat on the other side. Good. Now I'm just going to have you balance. If you could stand up, I'm going to have you close your eyes, and I will time you. I'm going to have you stand there for 20 seconds. Just give me 1 second. All right, whenever you're ready. Great, you are all set. You can sit back down. To finish up, I'm going to have you take a few steps. I'm going to have you walk heel to toe to me. Good, and then you can turn around and walk normally back. Great, and that is all I need from you today. Do you have any questions for me?
Nope.
Good, I hope you have a great rest of your school year.
Thank you.
Thank you so much for your time.